to Community Focus. We continue our conversation with Maria Phillips and also Ben Zelman. Ben is with Medical Mutual of Ohio and is here talking about the BabyLink program, and actually Maria Phillips is a BabyLink mom. Now, the name of your child that was born under the BabyLink program?
Kalen.
Kalen.
Kalen, but it's a boy.
That's pretty.
And then you already have a 2-year-old son.
2.5, Billy.
Okay. We talked about some different aspects of the program, and one of the things we mentioned was the fact that there is this phone number that you can call to get your questions answered, whether it's 2 o'clock in the morning, 2 o'clock in the afternoon, Saturdays and Sundays. Did you ever have to use
I
that?
never had to use it, but it's a wonderful aspect of the whole program, just because, especially for first-time moms, because a lot of time you don't want to call the physician and bother them, and sometimes they're just simple little questions, and you know, you can call anytime, day or night. Someone is there on the other end to, you know, answer your questions, which just makes you feel more comfortable and obviously will help you with the pregnancy.
You mentioned that you didn't necessarily seek out the BabyLink program, but you were sort of introduced to it. Do you think that a program like this would be helpful to first-time moms?
Oh, absolutely.
And in what way?
First-time moms, especially, there are so many questions. There are so many questions I had the first time. And luckily I had my sister-in-law and a good friend of mine were both pregnant at the same time, so I was constantly calling them. But other than that, and probably driving them crazy. But just to be able to call, because sometimes you're nervous, you feel that they're silly questions, and they're not.
Yeah.
And that 800 number was just, you know, is wonderful for someone that really, you know, it's something completely new. You don't know what you're doing.
It makes it a little easier when you have other people that have actually experienced that and everything. And one of the things, I think, Ben, is that, and we may have touched on it before, but that line is staffed by OBGYN?
The line is staffed by what are called obstetrical nurses, and those are nurses who have all spent at least 5 years on an OBGYN floor at a major hospital. So they have experience with what it's like to advise a mom. It's not some insurance clerk or dial-a nurse. It's really someone who understands how to produce the best results and what we call in healthcare outcomes for a pregnancy. So it's someone that you can really be comfortable talking with. All the information is confidential. You are asked if that information can be shared with your doctor, but if there's some piece of information that a woman chooses not to share with her OBGYN, that's really between her and the BabyLink nurse. So again, it's a real resource basically for people. It can also help identify home health care services that might be appropriate in the community, whether or not it's something like what's called tocolytic therapy or home uterine monitoring, which again is a way of helping bringing those babies to term. And again, make people more comfortable with the program. And Maria mentioned, makes you feel better, gives you a little bit of a peace of mind. And that's critical, really, in all healthcare. It's recognized, the connection between mind and body. But certainly having a woman in the appropriate mindset really helps the likelihood of a baby delivering to term. I wish I had this kind of program available to me when I had the privilege of having my 2 daughters, or my wife had the privilege, and I coached reasonably well.
I was going to say, wow, if you had the kids, we've got a heck of a show here, and I overlooked it.
We didn't quite do that. An Arnold Schwarzenegger movie, wasn't it?
The information, you happened to touch on something that was kind of interesting outside of the fact that, you know, naturally the information needs to be in several different languages for different nationalities and different cultures. How difficult has it been getting the word about the BabyLink program out?
Well, it was a program that we really had targeted without as much contact directly with physicians when it started. Although the program was reviewed with major OBGYN physicians throughout the region, we really didn't produce the kind of targeting that obviously helped Maria become aware of the program, where we tell the doctors what the program is, how it may benefit their patients. We even provide some pamphlets that they can include at their office if they have patients who are covered under a SuperMed program to give to those patients. We've also engaged in a whole set of communication materials. We think part of Medical Mutual's role is to communicate with patients more. So we've told all of our population, if you're pregnant, please try to enroll in this program, as well as contacting them about things like you mentioned earlier, getting their children immunized and adolescents immunized. And we even write letters directly to women who appear not to have the appropriate type of preventive testing according to the standards that have been established, and just remind them not to necessarily go have a test, but certainly to talk to their doctor about it and why it might be appropriate for them to get a test. And we find that by, I guess, caring a bit, that it really helps the health status of the population that we have, and makes certainly patients, we think, feel better about their coverage, and also does a little bit to dissuade some of the negative managed care press, because managed care can also be used to try to help educate physicians, educate patients, really giving patients more information about their health care, which is something that the baby boom generation likes to know more. We don't like to just be told what the answers are, and that's what part of what BabyLink is.
Do you think this is something that this type of program is something that will continue and possibly grow in the state or across the country?
I think that programs, that the companies that provide managed care will be successful if they can make patients and make members happy about the fact that they have a managed care plan. And one of the ways of doing that is to care about their health. So expanding a program like the BabyLink program, Medical Mutual already has programs for patients who've had congestive heart failure or asthma or diabetes. We're developing a program for patients with epilepsy. And again, these are all programs that are targeted towards those diseases, and I can say, I think, diseases there, or conditions. Pregnancy is a condition, I'll repeat that again, not a disease. And makes, again, the population's healthier, makes people happier about their plan, and even provides doctors with information. A very common thing that occurs is many doctors don't treat ulcers, about 80% of which are proven to be biologically based, a little bug called H. pylori. Many doctors don't attempt to use antibiotic therapy, where after 6 weeks the patients could be better, and sometimes they treat them for some period of time inappropriately. What managed care can help do is identify what's the right way to treat a patient, what's the right way to get a patient to term for a pregnancy, and have doctors know and be successful.
All right, we have less than 30 seconds. That number again.
The number,
especially if somebody wants to find out if they even qualify, or
absolutely.
if they're, you know.
That's excellent. And really, it's any Medical Mutual program. It's 800-338-4114.
Ben Zelman, thank you. Maria Phillips, thank you. Have a nice Mother's Day.
Why, thank you.
Please
You
do.
have a nice Dad's Day, too.
Thank you.
For this edition of Community Focus, I'm Stacey Edge.